Hello, everyone. My name is Gurjot Basra, and I'm the Manager of Patient Programs, Research, and Advocacy here at Lymphoma Canada. I've said that numerous times over the last 3 days. I promise this is the last time. I am pleased to welcome you all to the final session of the day titled Exercise for Lymphoma Patients, Maximizing Energy and Reducing Fatigue. We appreciate that so many of you have been able to join us live today. And before I introduce today's speaker, as always, a reminder that the Zoom software does not allow you to access video features or turn on your microphone. But at the end of the presentation, we'll try and take a few questions should time permit. And to introduce our speaker, joining us today is Regan Garrett, who is the Manager of Programs and Partnerships and the Exercise Program Lead at Inspire Health Supportive Cancer Care. With her background as a clinical exercise physiologist, she works alongside an interdisciplinary team to provide one-on-one and group supportive cancer care to the province of BC and beyond. So thank you for joining us today, Regan, and you can get started as soon as you're ready.
Awesome. Well, thank you so much for having me, everyone. This is a big love of mine. I love to talk about movement. I love to talk about how it can benefit us in all the wonderful ways that it does. And it sounds like this is quite a timely conversation being right at the end of the day. So if you're noticing that you're a little low on energy, maybe we can give you some helpful strategies that you can take beyond this talk to the rest of your evening. So our hope today is that we're sparking some curiosity about both the role that exercise can play if you're on active treatment or also beyond that. And just a quick note that, of course, within this conversation and the limited time that we do have, we'll be talking about the general population-wide information that we have available. So individualization is, of course, important. We all might be at a different spot in our journey or have had different treatments, experiencing different side effects. So support is always available on our exercise team here at Inspire Health, and I'll speak a little bit more about how you can get involved in that free support towards the end of our conversation. So to give you a little overview about what we will talk through today. So we'll talk about the benefits of exercise during and after treatment. We'll explore how to use exercise really as a tool to manage fatigue and how to gently add in more exercise into your routine, because we often get questions about the how we go about that. We'll explore exercise guidelines and how to tailor your exercise routine depending on the goals that you have. And we'll also touch on how to implement more movement just in general throughout your day. So starting here with our conversation around, well, what is exercise? What is physical activity? And really throughout our conversations today, you'll see both of these terms come up a little bit. But I think it's important to expand on because we really do see that a lot of the benefits that we expect from movement can also come from physical activity. So when we think about what physical activity is, this refers to all movement, including leisure time, that is produced by your skeletal muscles and requires energy expenditure. So this could be walking where you need to go. So if you don't have a car and you're walking to the store, you're walking to work or to see loved ones, any of that things. If you are doing chores around the home, that requires energy, that would be included in that physical activity goal. If you are gardening, that sort of thing. So these might be spontaneous instances. They might be out of necessity and may not have a specific goal in mind. And then rather, when we think about exercise, this is more so planned, structured, and repetitive movements aimed at improving overall physical function. So this tends to be the additional stuff that we're adding on to our day. So for example, are you going to a fitness class? Are you doing more structured movements such as squats, bicep curls, those sorts of things where you might not naturally do that as part of your day. Maybe you're walking or running outside of your typical active commute. These will tend to have a little bit more of that fitness goal in mind. So both of these are extremely important when we're talking about, well, how much physical activity are you doing throughout the week? And working on hopefully bringing in more to get the benefits of movement. So don't sell yourself short if you're doing those physical activity pursuits throughout the day. So when we think about the benefits of physical activity or exercise or movement during and after treatment, they are quite vast. And we're at a really exciting time within the exercise and oncology space that we have lots of research now available at our fingertips. The first heavy hitter there on your screen is this idea of a reduction of the risk of cancer-specific mortality. So this essentially relates to survivorship and includes a lower risk of recurrence in the development of other primary cancers. So when we look at the majority of the research that we have available, we tend to see that this research is done on groups including breast cancer, colorectal cancer, prostate cancer cohorts. And we tend to see that because, of course, they are more common forms of cancer. We do have more funding within that area, but we are starting to see through more and more research available that these things that we see, these benefits, are being replicated amongst other cancer groups. So collectively, we see that this data supports a lower risk of cancer-specific mortality, ranging from 26 to 69% of that risk reduction. Now, you might be wondering, well, why are those such different percentages? Of course, when we talk about 26 to 69, there's a big jump there. And that's because, of course, you can be a little bit active, you can be a lot active. So the amount of movement that we're adding into our day tends to have kind of an increasing effect as you work your way up. I also want to quickly highlight that what we do also see in the research is that you can still harness these benefits of physical activity post-treatment, even if you weren't someone who was necessarily that active or implemented a lot of exercise into their routine before treatment. So that post-active phase can still be a really powerful time to bring in exercise. We also see that overall, if you're someone who is regularly active, you have a decreased risk of all-cause mortality. So this more so relates to things like heart disease, metabolic conditions, all of that. So just promoting health in general. And then we also see related to the cancer journey that if we're someone who's regularly active, we do see an improvement in cancer-related side effects. So things such as cancer-related fatigue, lymphedema exacerbations, anxiety and depression symptoms, sleep concerns, bone health, deconditioning, and I could probably go on a little bit more, but do know that bringing in and maintaining activity really does impact how we feel throughout the cancer care journey. Now, switching gears a little bit to cancer-related fatigue. So when we talk about this, it's important just to note that it is the #1 most common side effect reported among cancer patients. It's estimated that between 70 to 90% of cancer patients do experience fatigue at some point in their cancer journey. And that fatigue can hang around a little bit even after you're done active treatment. And what we find is that it's a hard one to treat. So is it the treatment that's causing the fatigue? Is it the cancer itself? Is it something else that's going on during this time? But lucky for us and all of you joining in on this presentation today, exercise can definitely help. And it is considered to be one of the best non-pharmacological treatments of fatigue. It is also just important to note that there could be additional things that are impacting the fatigue that you're experiencing. So making sure that you're having conversations with your care team around, is there anemia, for example, at play? Are you getting good and high quality sleep during this time? Are you really struggling with anxieties related to this journey? So of course, we can use exercise as a tool, but it's also important to explore some of those other areas. So I really love to show this picture in most of the exercise presentations that I give. And this can just kind of paint a picture about how not moving can really be impactful to the amount of fatigue that we are noticing and feeling. And a disclaimer first before we get into this quick description, that rest is still really important. So of course, if you're recovering from surgeries, if you're feeling super wiped because it's the day after chemo day, all of those different things, yes, we still need to bring in rest, but I think that most of us here in this group might have experienced this at some point in time. So you might notice that you're feeling quite tired from whatever is that just happened. Of course, you have prolonged rest to recover from that. And you might notice that the next time that you go to do those things that maybe you normally used to do, those things are feeling a little bit harder to accomplish. It feels like they really wipe you out. They're taking the energy out of you. And so that the next time that you go do that thing after you've done more and more resting to recover from that bout, you're noticing again, it's becoming more and more hard. So when we talk about how exercise can kind of cut into this process and stop this kind of negative spiral from happening, it's helpful to kind of explain quickly what happens when we exercise. So I'm just going to use the example of a bicep curl because that's the part of my body that you can see. But if you imagine that I go ahead and I hold my weight, and it's maybe the first time that I've done a set of reps of bicep curls with this weight, what actually happens after that activity is I've had changes happen to my bicep muscle in order to make that activity happen. So I've had the buildup of different metabolites that my body needs to take care of. I might even have little micro tears within that muscle. And that all sounds scary, but that is the thing that then gets our body to pay attention to that area. And your body is really smart in that the next time that you do that activity, it will not only build back that muscle to where it was before, but it will build it back to be able to better accommodate what it was that you were doing the next time. So of course, this is a very simplistic, watered down physiological explanation, but we see that at different areas of the body when we are regularly active. So of course, if I were to do some sort of cardiovascular activity, it would happen within my cardiorespiratory system. And when we talk about it on a mitochondrial level, when we are doing things that exert ourselves, it increases the mitochondrial production in muscle cells. And if you think back to school, you might have that ingrained in you that the mitochondria is the powerhouse of the cell. But essentially, this is the area that creates fuel from glucose and oxygen. So the more and more that we are active, the more efficient our body gets at that process, and the more you will feel like you've got the energy and the capacity and the strength to do those things once again. So you might be thinking in my explanation so far that, well, you're saying that exercise can help with fatigue, but of course, in order to exercise, you need energy. And so our approach for fatigue management really matters here because many of you might have experienced a boom or bust cycle. Maybe you do feel like you've got the motivation or the desire to do some form of exercise or a bigger form of physical activity. You go do that thing, and then you experience quite a significant crash in your energy levels. And if that's happening, of course, you need to have more and more time allocated to recover. And if you think a moment ago how we talked about how those changes at the muscle level work in order to get those more efficient areas of the body, you need recovery in play to see those things. But we don't want you crashing and needing a whole lot of recovery before you're able to do that activity again. So when we're talking about fatigue mitigation or management, little and often really helps to make activities more manageable and realistic and consistent so that overall we're able to see that gentle improvement of our physical capacity. And it also gives us a small win. So if you're doing activity that's at a intensity that works for you and for your body, you will feel like it gives you a little bit more of a pep in your step following that activity. And that's our goal of exercise. So it could be really small to start, and that's okay. But adding in those small and gentle little breaks throughout your day can be really helpful and leave you feeling energized and not totally exhausted. So we often refer to something within our organization to help with fatigue management called movement snacks. And this is essentially adding in these really small little bite size, and I guess I'll say pun intended because we're talking about movement snacks, but they're small little bite-sized bits of movement that you can bring in throughout the day. So I've got one shown here on the screen that, of course, might not be where everyone is at, but for example, asking yourself the question of what movement do I know that I can confidently complete? So for example, maybe it is getting up, walking around your home for a certain amount of time. You know that if you do that activity, you're not going to be totally exhausted. And seeing if you can add in a few more variations of that throughout the day if your energy levels allow. And from there, as you start to make your way up in terms of that physical capacity, can you build in more and more, or start to modify whatever it is you're doing to be a little bit more intense? Of course, again, I've got a note here that us at Inspire Health, we can help with that, and we'll talk about how to get involved. But these movement snacks can really be whatever you want them to be. So we talked about getting up and moving around the house. You could also have a strength or resistance training snack. So maybe you're breaking up a bigger physical activity program into groups of 2 exercises. So for example, I could do a squat mixed with a bicep curl. I spend 5 minutes on that, and I put it down, I leave it, and then perhaps come back to it later in the day if I have more energy. It could be an aerobic snack, so picking 2 of your favorite aerobic-based exercises. It could be a small walking snack, maybe within the home, outside the home. You could even do this with chores. So if you know that you've got lots of things to do that require some of that physical capacity, trying to break them up, but stacking them within the day to overall add up to more movement throughout your day. We often talk about something called the 3 Ps, which can be quite helpful if you're really struggling with fatigue. So asking yourself, how can I address some planning here? So knowing what you need to do each day, what's on the agenda, so that you're allocating a little bit of extra energy for that. So try not to overbook yourself on those days. Prioritizing. So out of those things that you have to do, what's the non-negotiable? And maybe you're planning to do that earlier in the day or when you have the most energy. And then talking about pacing, so balancing the above activities with a little bit of rest to hopefully avoid a crash. And as you're feeling a little bit more energetic, maybe you're starting to bring in some of those movement snacks within at the amount that you're able to tolerate to hopefully leave you with that feeling of energy. Now, we get asked this all the time on our exercise team at Inspire Health, but the question is around, well, what is the best exercise that I can do? What's going to be the most effective? And so our answer to that question is always, well, the best exercise is what you enjoy. So all the research that we've reviewed today, both with the management of fatigue and cancer-related mortality risk, has definitely something in common, and it's that if we want to see these benefits and we want to see them long term, we need to be consistent with bringing in movement, with bringing in exercise or physical activity. And of course, in order to be consistent at something, we need to enjoy doing it. So if you absolutely hate the form of activity that you think you need to do, you're not going to want to do it. And so when you're feeling quite low on energy, it's just going to be even more difficult to implement that thing. So you can get creative, you can try out different things and see what you really enjoy. Now, all of this being said, though, there are benefits to different kinds of exercise. And so just to give us a quick little overview of what we would typically consider in a well-rounded movement routine, we have aerobic activity. So this is really anything that gets your heart pumping. So you can think about walking, biking, swimming, running, even movements that are often incorporated into fitness classes, such as like your low impact jumping jacks, you're marching or running on the spot, those sort of things. Our overall guidelines are typically around beginning with 30 minutes of light to moderate activity 3 days per week. But remember, you can break that up. So see if you can make some snacks that kind of equal that amount throughout your week. And then eventually our hope is that we're progressing to 150 minutes of moderate to vigorous activity per week when you are ready. We also do talk a lot about strength training. So strength training, or often known as resistance training, is anything that's working those muscles. So you might think about that classic, like I'm holding the dumbbell, I'm doing bicep curls, squats, overhead presses, that sort of things. You could also implement the use of resistance bands. You can even use body weight to begin. And a lot of fitness classes or fitness supports that are out in the community will incorporate strength training in a lot of different ways. Balance training also deserves a shout out. So if you're someone who has experienced peripheral neuropathy or changes of the sensation at the bottom of the feet, it's really important that we're trying to challenge our stability in a really safe and controlled manner to make sure that we are staying on top of falls risk. And then of course, flexibility. We want you to be doing stretches and proper cool downs when you're completing routines, exercise routines, of course. Now, if you're starting from a place where you're not really able to do any physical activity at this time beyond like taking yourself to the washroom and whatnot, even challenge yourself to see if you can break up sedentary time in some way. So maybe it means that every 30 minutes you're doing a little bit of a stretch where you're kind of just getting up, moving around a little bit, and then coming back down. So there's lots of different ways that you can approach this. I did just mention on the screen a call out to understanding exercise intensity. So we said light to moderate, we said moderate to vigorous. And this is just the perception of how your body feels about an activity. So is it working really hard to make that activity happen? How hard is it feeling that activity is? We can, of course, get fancy with heart rate monitors, and we can calculate windows that we would like you to be. But you can also use something called a talk test. So this is just a way to check in with your body, and it actually relates to your breathing rate. So when you're doing light intensity activities, you'll feel like you can really talk freely. If I asked you to sing, you'd feel like you could. If we move into moderate intensity activity, this would mean that you can talk, but singing is difficult. So if I asked you how you're doing in my exercise class, you'd be able to tell me, but you might not be able to continue a conversation. And then when we cross into vigorous, your breathing rate is coming up so much that it gets hard to have those conversations and hard to sing when you're doing those activities. When we go back to a few slides ago and we talked about that gentle introduction, if you are starting at a place where you're not doing a whole lot of activity, start with those light movements and gently progress from there. Now, speaking to the fact that some forms of activity do have certain benefits, we do have different research to support the different kinds of exercise to implement depending on what your goals are. So this is a summarized picture that was taken from one of the American College of Sports Medicine works that came out a few years ago. But for example, we know that if your goal is mental health, so support with anxiety and depression, aerobic activity is really where we have the most research providing benefit to that area. If your goal is support with lymphatic health or lymphedema management, we know that incorporating resistance training is really impactful there. If your goal is better sleep, we want to make sure that we have aerobic activity as part of your routine. And if your goal is bone health, we can call on resistance training to help with that. So you can definitely come in and see our team with some support with this. But as mentioned earlier, it's a super exciting time within exercise oncology because we have wonderful research like this. If I leave you with one message today, it's that do what you can to really prioritize movement. And this can start in a really gentle place. It can progress from there, making sure that you're moving as often as you can. You can get creative with those movement snacks, choosing activities that are bringing you joy, and considering things that you're already doing. So for example, if I know that I need to walk the dog every single morning, could I incorporate a later second walk if I'm feeling up to it? Could I start to push the distance that I'm doing or add in a route that has a hill, for example? If you're feeling quite low on fatigue, it can be helpful to schedule exercise when you are feeling the most energetic. So you can kind of note when that time is and proceed. Perhaps you're calling in on friends to move with you. And of course, you can always maximize exercise effectiveness by making sure that you got enough recovery in between sessions, listening to that fatigue cue that your body is sending to you. So if you're really feeling quite tired after a bout of activity, maybe it was a little bit too much for you at that time. And then I would love just to dedicate a few quick moments to talk about my organization. So I work at Inspire Health Supportive Cancer Care. And really what we do is we offer free guidance and support for people with cancer, no matter where they are in that journey. So you could be newly diagnosed, you could be on treatment, it could be 20 years since your diagnosis, and we would still provide that free support for you. We also do provide support for those who are at high genetic risk, as well as the support people who are supporting those with a cancer diagnosis and those who are at high genetic risk. All of our programs and services really do emphasize evidence-based lifestyle approaches, and our goal is always to make sure that we're improving the quality of life of those touched by cancer. So we've got a team of clinical counselors, clinical exercise physiologists, dietitians, and supportive care physicians. Our exercise team is a wonderful resource for all of you. So our organization, we do provide services across Canada, and our exercise team can do both one-on-one sessions. Again, across Canada, we can do in person if you're out in BC, or virtual if you're anywhere else. And we also do run a whole host of exercise classes throughout the week that we would love to get you involved in should you be interested. So if you've got any of those questions about how do I use exercise for energy, how do I implement a movement routine, how do I get support with recovery post-treatment, all of these things, we would love to see you one-on-one to address those questions. So I'll leave this here with you here for a moment, just in case. So this QR code links to our registration page if you are interested. And once again, the support is free and you have access to a clinical exercise physiologist no matter where you are within Canada. We do run orientation sessions 4 times a week if you would like to learn a little bit more about our organization. And if you fill out the form that it will link to, you can book that one-on-one session right away. And we do require that one-on-one session before you're able to engage with our ongoing exercise classes. But you'll see lots from us from different kinds of yoga options. We have strength classes. We've got beginner strength classes. We've got specialized programs such as young adult exercise programs. We have specific classes for those who need a little bit of extra support and need something specific for them. So please do connect with us if you're interested or if you've got any questions. Okay, and I'll go ahead and leave this here.
Thank you, Regan. I personally love the idea of movement snacks. I thought that was a great concept. As a reminder to the audience, at this time, you can submit your questions in the chat as we do have a few minutes. So a question did come in referencing cardiotoxic drugs that can weaken heart muscle. So do you have any advice or suggestions to someone on a cardiotoxic chemo agent and how to safely exercise?
Yeah, so my first annoying comment would be come and see us because we would love to talk about your own unique situation. Because what's also important to note there is what are you currently doing, right? So we would want to make sure that we're building on those things, but that we are being really gentle and safe in the way that we're doing so. But overall, we do see that we can have a lot of positive impacts in that regard. So if you haven't connected with us, please do go ahead and do so. I would love to meet with you one-on-one.
Okay, and should exercise routines change depending on whether someone is newly diagnosed, in active treatment, or in remission?
Yeah, so I think it's a yes and a no. So I would say that the most important thing is our approach to activity should change a little bit. So we would, of course, want you, if you're in active treatment, to be checking in with your body probably a little bit more. You might notice that your capacity to do certain kinds of exercise on specific days within that cycle, depending on what treatment you have, might change. So we would want to make sure that you have lots of different tools to pull out depending on how you're feeling. But of course, at different times, we might have a slightly different focus. So for example, if you are post-treatment, we might be working a little bit more on that kind of like recovery rehabilitation. Whereas before treatment, we might be working on getting you as strong as we can before treatment. And then during treatment, our goal might be more so focused on maintaining function, maintaining your energy levels, and making sure that we're doing what we can to mitigate additional side effects.
Okay. And the next patient has always been very active. So are there warning signs that I should watch for that mean I need to stop exercising?
Yeah, so the biggest one, and what we typically find on our team to be kind of that first warning light that something might be a little bit too much, is your energy levels. So for example, if you have always been quite active, if you're doing the things that you used to normally do, just check in to see if you're having the same response. So what would be like a normal response to that activity is if I did something today for physical activity, but I didn't do it yesterday. I would expect that by the time I'm like winding down, it's the end of my day, I might feel more ready for sleep. That would be normal. But if I'm finding that the activities that I'm doing are depleting me right away, so maybe like 30 to 90 minutes after I'm feeling like I can't carry on with the things that I had planned to do that day, that could be a sign that we're doing a little bit too much at that time. And of course, it might depend on where you are in that treatment cycle. So it could be that you can't tolerate those activities as efficiently when you're on your chemo week versus maybe if it's been a couple weeks. For example, if you're on a 3-week cycle, of course it depends, but just checking in with your energy levels, I think will give you a little bit of guidance.
Okay. And the next question is quite interesting. So my family wants to help me stay active, but I don't want to feel pressured. How can I involve them in a supportive way?
Oh, that's a wonderful question. I think that it can often be really helpful to have a really robust toolkit of what exercise and movement could be at that time. So having resources for lower intensity, lower impact movement, but also having that plan for when you do feel like you're a bit more high on energy that you can do those other things. So you can also agree with them after this presentation that yes, movement's really important throughout this journey, but having those different things that you can pull out depending on how you're feeling, so you're not pushing it too far, and maybe inviting your family members who care lots about you into those lower intensity practices if needed. I hope that that's a helpful explanation and suggestion.
Perfect. And with that said, I just want to say thank you everyone for joining, and thank you Regan for that fantastic presentation and for taking the time to answer questions today. Generally, it has been an absolute pleasure being able to host yet another conference, and I hope that over the course of these 3 days, you were able to access the information you were looking for. Thank you everyone who submitted questions, as there's been great participation throughout. And as a reminder to the audience, please be sure to complete the survey on the conference platform before you leave today, as feedback is always appreciated. And additionally, if the conference has sparked your curiosity and you now have additional questions as part of our Ask a Lymphoma/CLL Specialist Q&A program, we do offer the opportunity for you to submit your questions in advance to have them later addressed in a live webinar. The next 1-hour designated Q&A session is taking place on October 30th, featuring our specialist, Dr. Anthea Peters. For more information on this program or to submit your questions, please visit www.lymphoma.ca. With that said, I would now like to direct the audience to attend the closing remarks, which are going to start in about a minute. Thank you, everyone, and have a wonderful evening or night.